So today we're going to talk about inhaler techniques, specifically the meter-dosed inhaler, which most people have a problem with taking, and often they don't realise that they're doing it incorrectly. Partly to blame is the television, because most of the people and actors on television, specifically the James Bond movie, are not taking their inhaler properly. It's a bugbear of mine. So the MDI is a metered dosed inhaler. It doesn't matter if yours is blue, grey, red, green, pink. It's the device that we're talking about, not the drug. So the first thing that you would do when you were prescribed this, or you have one of these inhalers, is check it's in date. So you can pull the canister out of the top and check the date on the side and pop that back in, and just clicks back in. Obviously if it's out of date, go and get an in-date one and don't take out of date medication. The next thing you would do is take the cap off. Some caps are slightly different and they might be attached, and just check there's nothing in the mouthpiece that you're going to inhale. So all sorts of dirt and things can get in there. The next thing you're going to do is shake your inhaler, because in the canister is propellant and medication, and it's in a liquid form, and you need to mix that like balsamic vinegar and olive oil. So you give it a little shake to mix that up, so you're not just taking in propellant, you're actually getting the drug. And then you're going to make sure you've got good control of your breathing, because to take this you can't do it properly if you're breathless. You're just going to exhale the drug before it's actually got into the lungs. So you get some nice breathing control, and there's another video on controlling your breathing. And then you're going to put your mouth around the mouthpiece, get a good seal, and you're going to coordinate the pressing of the inhaler with inhaling. And you can see from me pressing that the drug travelled really far in a really short period of time. It turned the drug from a liquid into a gas, because I've shaken it, and it uses changes temperature to do that. So you need to make sure that you actually don't inhale very hard. If you inhale hard, it just fires it into the back of your throat and on your tongue, and that can give you side effects as well as you not getting the drug into your system. So what you need to do is inhale incredibly slowly, and you have to consciously go slowly to do this. So it's not like a quick, easy thing to do. You have to really think about it. So I've done a shake, seal, breath out. And then I'm going to hold my breath for 10 seconds to try and get the drug to get down as far into my lungs as possible. And that will just be through diffusion, because I'm inhaling. It doesn't need to be a big deep breath. So you shouldn't hear that in breath. So I'm going to repeat that technique from start to finish so you can see what the optimal technique would be. You need to leave at least 30 seconds between puffs to allow the canister to settle back to room temperature, so you're not just going to be putting liquid into your mouth rather than gas into your lungs. And then you pop the cap on and you're all done.